Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark, guys. I'm here with the one and only Steve Dale today. Steve Dale is, how to describe Steve Dale? He does a million things. He's the host of 4 different radio shows. He is a pet journalist. He is a writer. He's got more books than anybody that I know. I think he's a fascinating, interesting person. And I had Steve in today, and I said, Steve, help me understand what pet owners actually want. And he lays down a great thesis. He talks about the rise of the fur baby and what that meant as a cultural shift. He's talking about how that intersects with people's demand to have immediate service, convenience culture. And he talks about technology and how pet owners are using technology. And he's I don't know. I really like a lot of these ideas. I think he takes a lot of things we all see and he bundles them together into a nice little package that makes sense. And go, oh, this is useful in conceptualizing the world we live in right now. So anyway, I really enjoyed this episode. I hope you will as well. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Steve Dale. How are you, my friend?
Oh, man, I'm great because I'm here with Dr. Andy Roark. How can I not be?
It is so good to have you. You and I have been friends a long, long time. I was lamenting with you before we came on. I've not gotten to see you as much as I used to since the pandemic. For those who don't know you, it's hard to give you a title. You are a certified animal behavior consultant. You are a frequent writer. I think I saw one of your columns in Today's Vet Business recently. You have a blog at stevedale.tv. You have chapters and contributions to countless animal and veterinary books. You have 4 radio shows. You are like me. You're a man of many interests and hobbies. And so, yeah, thanks so much for being here. I was thinking about you recently, and I was looking at some. I know I was looking at some of your writing, and Steve, I think the title that I would give to you, I don't know that there's anyone else who is enmeshed in veterinary medicine that thinks about the experience and the perspective of the pet owner as much as you do. You are a real advocate for pets and especially for pet owners. And I think a lot of times when we start talking about the future, and I like to sit and think about where all this goes, I can't help but look at it from the perspective of a veterinarian or someone who's very much an insider in veterinary medicine. And so I was sitting there and I was thinking about the future, and I was thinking about artificial intelligence and how it interfaces with pet health and with pet owners and with who knows, products, technologies that pet owners are going to want to use. I was thinking about home delivery. I was thinking about home delivery of products and services. I was thinking about mid-level practitioners and all of these things. And I was like, I wonder what pet owners want in all of this, and I wonder where their mind is. And I don't know that there's a better person than you to kind of start to have those thoughts, because you do so much in that space of listening to pet owners, talking with pet owners, things like that. And so let me just kind of pause here for a second. I'd kind of like to open this up and say, Steve Dale, when you think about pet owners, the modern pet owner, what do they want, and how is it different than 5 years ago?
That's a big question. So pets have been for a very long time members of the family, but the bond is more intense than it ever has been. I remember some number of years ago when people really began to use the term fur babies. And a lot of your colleagues, veterinarians, and I might have been in that camp too, said, whoa, come on, they're not babies. But to a whole lot of pet parents, that's exactly what they are. They are their babies. They feel that they are their babies. And incidentally, and I'm going to talk a little bit all over the place here, but it comes to mind that fear-free and cat-friendly practices came along at just the right time. And the reason for that is because today, it's the perception, which is the important word here, is that you are in some way not treating their pet emotionally appropriately. I'm not talking about medically, you saying one thing, or I'm talking about the emotional well-being of that animal. and or manhandling the cat. It wasn't, or dogs, but cats in particular. So it wasn't all that long ago, and I can still go to YouTube and find videos of veterinarians today that the cat is in the carrier, they're turning the carrier upside down and going, "Come on, cat, get out of the
shaking
carrier."
it out, yeah.
And then they get the fishing pole out, the fishing net, literally to grab a cat. Well, today's clients greatly would just walk away. They're not seeing you ever again, and they may not go to a veterinarian for a very long time as a result of that. They want their pet to feel good during the visit, and they themselves want to feel good about the visit. So that's one thing I think that has dramatically changed. And that was changing, but then along came the pandemic and the profession infusing X number, and I've got the numbers if you want them, but X number of veterinarians and technicians, certified, licensed, credentialed technicians into the profession. And at the same time, losing more than we're entering the profession for a variety of different reasons that we could talk about if you like. At the same time, all that is happening, more people bringing a pet into their life. During the pandemic, or at the onset of the pandemic, shelters and rescues everywhere around the country and to a great extent around the world said, and I quote, "Help," because they didn't know what was coming. They didn't know if their volunteers or staff could go in to feed the animals. They didn't know if anyone could be there to scoop boxes, take dogs for walks, etc. So they needed to clear the shelters like never before in history. And people stepped up. So the number of pet parents skyrocketed. Noted there, I said pet parents, not pet owners, but it's skyrocketed just almost overnight. So you've got that happening, more pets today than ever before. Most households in America have at least one pet. There are more pets in America than there are children. That's what it's become in this country, and I love it. The problem is all those animals need veterinary care, and we are not accustomed to waiting for that veterinary care. And in part because people have left the profession, in part because there are more pets, and in part because our patience as a culture has disappeared. It has nothing to do with veterinary medicine. You walk into a restaurant and the waiter doesn't come in 2 minutes to say, "What's your order?" Then I'm writing a bad review. We've totally, as a culture, have changed. That impacts all service industries. And when it comes down to it, in some ways, veterinary medicine is a service industry. Then add one more thing in, and that is pre-pandemic, veterinary medicine was not keeping up with technology. What physicians, for example, or dentists could do on a daily basis routinely, veterinary medicine was not doing. And now, more than ever before, clients are saying, "You need to do this." And I'll talk about what I mean by this, if in fact you'd like me to.
Yeah, well, so there's a couple things here, but let's go ahead and start with that. But then I want to come back to some other things you said. But so you're talking about embracing technology. What is the type of technology that you're talking about that pet owners are saying, "Why aren't you guys on board with this?" What are the pieces that they see? Because when you say technology, I immediately think practice management software. And I don't think that's what pet owners are thinking about at all. They don't see that. They're very much looking at consumer facing software that we're not using. What are you saying, Steve? Are you basically saying that we should have apps? Is that kind of where your head is? Like, what does that mean to you when you start talking about technology that pet owners want?
Most pet owners today, I'll back up one step, are millennials. And those who aren't are Gen, I'm getting my X's and Z's mixed up here, are Gen Zers, right? Is that right? I think. And what I do know is that millennials have impacted every generation more than any other generation before them. So what they do, their parents are doing, and what they do, those millennials that are old enough or do have kids, because for so many millennials, I mean, we're talking so many millennials, their children, their only children, and I'm in that bucket. I don't know that I'm a millennial, but don't argue with me, are their four-legged family or feathered family members, or, that's their kids. But for those that have kids with two legs, they impact, of course, what they do as well. So on both ends, they are hugely impactful. And let's talk about texting, for example. That is the preferred communication for anything, having nothing to do with veterinary medicine for the moment. That is how millennials prefer to communicate. We know that through all sorts of surveys. Well, they've taught their kids to do that, and now their kids are old enough in many cases to have pets. And their parents, who we thought, they don't do that kind of thing. But during the pandemic, there are a surprising number of 90-year-olds that actually do text. So not only the parents, in some cases, their grandparents. And to think that that's not preferred communication or whatever veterinary medicine thinks, I think sometimes it's just not thought about. But in fact, it would save veterinarians time and money to utilize, I don't know, Weave or those sorts of services more often, just to, okay, you've got a dog that came in for a routine prophylaxis, right? Instead of calling, you tell me what happens when you call the pet parent. You get their voicemail because they didn't recognize your number. You get their voicemail because they don't pick up the phone anyway. You get their voicemail because they're on the other phone. You get their voicemail because they're busy doing something else. Then they call you, and maybe the line's busy, and then they forget to call you back. I mean, so much time is invested in that. Well, a text is going to go through in all likelihood. What's more, there are lots of software services that you could send GIF or GIF?
Yeah.
I forget.
I go with GIF, but I've been argued with many times. But
you can send an image that moves. How's that?
Yeah, I like it.
Of the pet. And pet parents love that. So now they can see their dog, quote unquote, smiling, and the text simply reads, your pet is ready. Of course, if there's an issue in that routine dental that turned out not to be so routine, we needed to pull 4 teeth. After all, it's a 12-year-old Yorkie. Then of course you make that phone call. That's
not a GIF communication. I agree with that. Like there's the problem is not, we don't communicate that with GIFs. But no, I like it. Of course,
but most of the time there isn't.
If you dream of doing team training with your team, getting your people together, getting them on the same page, talking about how you guys work together in your practice, I'd love to help you. You can check out DrAndyRoark.com and check out the store. I have 2 different team training courses. These are courses for teams to do together to get on the same page and to talk about how you do things. I have my Angry Clients course and I have my Exam Room Toolkit course, and they are both available and there. Check them out. All right, guys, let's get back into this episode. Well, I love it. I love this goes right back to your point at the very beginning, which was the transition towards fur baby as this powerful term. You're talking about integrating that sort of that culture into the communication that we have in a significant way.
Yeah. And it's not being done now. If you think about it, Andy Roark, you don't feel well. You're going to call your doctor? Maybe. You'll probably go to a portal and ask the doctor a question, and the doctor will answer very quickly, depending on your doctor, through that portal. That is the way human medicine works.
Yeah.
That is increasingly the way dentistry is working. You can even make appointments online. Veterinary medicine is not there yet. That is what clients want. Yeah. And the big thing clients want is to do what we're doing right now, virtual conversations. And it can be done. It comes in 2 buckets.
Okay.
One should not be controversial. There's a patient-client relationship, maybe for 20 years, I don't know. And still, it's not being done. Registered, certified, licensed technicians can mostly answer those questions. Questions like, how is the dog or cat doing following surgery? That can be a virtual follow-up conversation, which incidentally, also shows how much you care. Clients want to know that you care. So it's a win-win. And maybe there's something that needs to, let's increase that pain medication, that analgesic or whatever, because you're doing that follow-up. For behavior, you can actually see where all those litter boxes are in their house or lack of litter boxes and have that conversation all done virtually. You cannot really, I don't think, unless you have stairs in your exam room, see the dog or cat go up and down the stairs, and you can't see them move like they move at home anyway, of course. So for osteoarthritis, of course, I'm not saying that this is a substitute for palpation or for radiographs or any of that. But for follow-up, for sure, is Silencia really working? And this other, massage therapy, are you doing it correctly? Are you using the Assisi loop correctly? Whatever. You're able to go through all of that. These are all potentials, and I'm just touching on the surface of what can be done and should be done, in my opinion, virtually. But I go further. I say there are services out there now, like it or not, good or bad, services out there now, veterinary professionals, technicians that are licensed, certified, registered technicians, as well as veterinarians that are talking like you and I are talking. I ask you, my dog is limping. Should I worry? Here, you can see the dog doing what the dog does. I'm talking to you because I can't reach my veterinarian. And that's a big problem. For a variety of different reasons, including the fact that we are, as I mentioned, more impatient as a culture than ever before. We don't want to wait 2 weeks. Historically, veterinarians have been so responsive as a profession. People are not accustomed to waiting 2 weeks because they are their babies. They can't wait 2 weeks. It's their baby. They want to know what's happening. They need to know what's going on. And if you're not able to see me, I need to see somebody else. And that someone else could be Dr. Google. That someone else could be the lady who lives down the hallway in an apartment building who has 7 cats. Therefore, she must know about
She must know,
That person could be anyone, a dude at the dog park. Do I really need a Lyme vaccine? I don't know. I can't reach my veterinarian. You then can work with these companies that are there anyway. They are there anyway. They are doing what they are doing on the fringe, so to speak. But this is what I know pet parents want. And organized veterinary medicine has said, no, we can't do it. I don't get that because physicians can, which include pediatrician, which knocks the argument down. The argument has been, well, you're speaking for the pet can't speak for himself. Well, I don't think an infant can speak for him or herself, and the parent is speaking for that baby. This is no different than the furry babies that the parent is speaking for.
Yeah. Okay. Wow. So that's a lot. I love where your head's at. Just sort of thinking about where we go from here. You had talked about wait time for care as one of the big drivers. Before we got into technology, you were talking about wait time, and you were talking about. I feel like you're building a pretty robust argument here of again going back to the idea that pets have been elevated in the minds of pet owners, and now we're at a place where we've had a labor shortage. We've had more people leaving the profession than coming into it. Wait times are increasing, and then that we add in technology, and you're saying, okay, well, in your opinion, these sort of the fringe outlets where people go to get pet health care that maybe veterinarians would not endorse or recommend, you feel like that's coming up because it's harder and harder to get into the veterinarian. Is that, just sort of closing the loop, is that an accurate sort of summary of your position?
Well, people for several years have been going to Dr. Google, right? That's not new. But given no other choice, people are going to go anywhere they can to get advice. Think about in your own life. You can't get legal advice from your lawyer because your lawyer is spending all your money on a trip to Bermuda. So instead, you reach out to someone else who you know is the lawyer. You ask that question, even though the question you have is about copyright and your lawyer's a copyright lawyer, and the lawyer you're asking is a ambulance chasing lawyer. There are none of those, of course. It's a different kind of lawyer. you know you're not getting the best advice, but you're getting something.
Yeah, no,
that is
makes
what pet parents want.
That makes sense to me. I do buy that. I'll give you the best example I can give. I think is in your own personal health, or at least for me. At some point there's this gray zone between when I feel bad, when my stomach starts to hurt, and it doesn't go away for a day, and when I pull the trigger and go get in to see my doctor, where I am on Google. And I'm not the only one. I am definitely not the one now who's like, my knee hurts. What stretches can I do for my knee? What YouTube physical therapy exercises can I find? I said, I don't want to live in a glass house and cast stones. And so I do agree that that's kind of where a lot of people go. When you start to think about access to care, Steve, and getting people in and sort of meeting this need and saying, because I'm 100% on board with you. I think people's patience is getting shorter and shorter and shorter, and convenience really is king. And people, when they decide they want something, they want it yesterday. And they've got YouTube or Amazon flying things in with drones to drop them on their doorstep. And like, that's the world that we're living in.
Access to care, if I may jump in there, means a couple of other things as well. It's not only everything you just said, and I already spoke about, which is true, but we would also open up opportunities where there aren't currently. For example, there are communities all over, including the city I live in Chicago, that have veterinary deserts for miles in certain neighborhoods in our city that I live in, but cities all over, urban areas all over the country. There aren't veterinarians practicing. So having the opportunity to speak like we're speaking now online, to do virtual care, would provide some comfort and some level of credible care for those folks. There are people all over America that live 80 miles away from a veterinarian. That's a small animal veterinarian, per se, that might live in, middle of Iowa, but not near an urban center in Iowa, and therefore not near a veterinarian. So this technology, which isn't all that technical really anymore, it will help other people as well.
Okay, so here's what I want to do, because I'm on board with this. I want to hand you the cone of shame magic wand that I have here on the podcast, and I want to give it to you. And I'll say, Steve, now using this magic wand, meaning you could craft this in the way that you like, right? Like you can say optimistically, this is what I would like to have happen. Can you use it and then tell me what medicine looks like? That medicine looks like in 5 years, and just say, if I have my magic wand, if I could build this system the way that I want it to be, given everything that we've laid down so far in this conversation, Steve, help me see that vision in your mind. What can this look like?
It's been said that millennials, which are driving veterinary care and services around America of all kinds, because so many, we're talking, that's where the numbers are at, right? That's where, therefore, the money is at. So, and as I said, veterinary medicine is a service industry when it comes down to it. So, what I would do is do what the millennials want, not only because they want it, because it's the right thing to do, and it should be done. It's not a difficult thing to do. That includes, so one more thing, millennials, it's been said, aren't going to be loyal. That actually is not true. If you can show them that you can respond the way they want responses to them. And we're talking about changes in communication patterns. So if we can provide virtual care in any way by credible individuals, veterinary professionals, any way whatsoever, whether they have a relationship or not with that veterinarian, that's one thing. And then the second thing is to use technology like texting. I'm not even sure that I would call that technology anymore.
Yeah.
Using portals, which, as I say, other medical professions have been using for a while, even predating the pandemic. Using what is available to communicate the way in which pet parents want to be communicated. And at the same time, you are relieving yourself. You are making life easier as a veterinary professional for yourself. You are pleasing technicians because you are giving them work to do that they are qualified to do, and they're doing it. You're not doing it. That's better for the practice.
No, I love that, buddy. I think that's such a beautiful vision. I like where your head's at. I like how you're thinking. What are the biggest pitfalls that you see for vet medicine going forward? Where do you think our profession or individual practices, what are the mistakes that they're likely to make, or that would be disastrous in your mind, given the vision you just laid out?
I'd like to think that's not going to happen.
Yeah.
The mistake would be to not pay attention to anything that I am talking about. So the good, not because I'm talking about.
I agree. The biggest mistake people make on the regular is not listening to me. I'll tell you that. I can't tell you how many people. My wife makes that mistake all day, every day, and it's
no.
sad.
I would not say that about my wife, because we're going to be married 30 years, and I want to keep it that way. I think that I know that the profession has grand plans for doing all sorts of things, like creating a new position that would be this mid-level position, which would be like in human medicine, it would be help me.
Nurse practitioner?
Nurse practitioner. In veterinary medicine, whether that's good or bad, it's not happening tomorrow. I have a view about that not being so good, but let's worry about that later. It's not going to happen now anyway. It can't happen that fast. To add more veterinary schools, to add larger classes to veterinary schools, that is actually beginning to happen. To go into primary schools and encourage people in all neighborhoods in America to go into veterinary medicine, or teaching humane education. I mean, on and on. All these plans that are wonderful, that aren't going to change or be of any rescue to the profession today, to pet parents or to professionals. And what I'm talking about, veterinary professionals could do today, literally.
No, I think that's great. I love that. So sort of summarize the point. The biggest pitfall is not getting serious about the service that we're providing right now that pet owners are demanding. Yeah, I think that's a great point. I think that's a great word of warning. Steve Dale, you are amazing. I love your energy. I love getting to talk to you. I love hearing your ideas and how you look at the profession. Where can people find you? It's not hard. You're everywhere. What are your favorite platforms and places for people to connect with you?
My favorite is my own website. So I write a blog post pretty much every day, stevedale.tv, stevedale.tv. And you can find me in social media, wherever your social media is. And I've not been on TikTok until recently. We now have a kitten who's no longer a kitten. He's a year old. And I thought, okay, Groucho, that's the kitten, ought to have a TikTok page. So you can find Groucho _ the funny cat on TikTok.
Groucho, the funny cat on TikTok.
_ the funny cat, right?
Thanks so much for being here. Guys, thanks for tuning in. Take care of yourselves, everybody. I hope you enjoyed the episode. And that is our show, guys. That's what I got. I hope you enjoyed it. I hope you got out of it. Thanks to Steve for being here. As always, if you enjoyed the podcast, share it with your friends or leave me an honest review wherever you get your podcast. That's the nicest things you can do. Anyway, gang, take care of yourselves. Be well. Enjoy practice. I'll talk to you later. Bye.